Hi, today I'm here with Aisha, and she is just had expansion of her palate. We're still straightening her teeth, but when I first saw her, Mum came to see me for a second opinion because all she was offered was either 4 teeth out to line up the teeth or orthodontic surgery of the jaws, right? Now this young lady is a very talented gymnast, the concept we have is to try and improve nasal airflow. And if you look at Aisha's first photo, which I'll show you, the palate was like this shape. And what we did with slow expansion, we widened the palate. And that changes the vault of the palate to help the nasal breathing, right? So I'm just gonna have a look at your bite. Just close together there, great. Good, so you've had no problems wearing those elastics?
They're a bit sensitive when at first. Okay,
the more you wear those, the quicker I can get those canines down. But at least now you have plenty of space, right? Do you want to just take the elastics off for me for 1 second?
Yep.
So the elastics we're using now is to settle the bite. So this young lady, and I'll go through the records with you, had a very narrow palate and what we call a long face. When you can't breathe through your nose, you adopt an open mouth posture, so your lower jaw, rather than grow forward, tends to grow vertically. And you can kind of see that in the initial x-ray. So our goal in treatment is to help reduce the adenoids because they're contributing to the problem. And sometimes if we widen the palate and teach the child to change breathing from mouth breathing to nasal breathing, it helps with facial growth. It also helps with her sleep because mouth breathing doesn't give you as good quality sleep as nasal breathing. So there's a number of benefits to this rather than just straight teeth. But if we look at the teeth, just open again for me, you can see that nice wide palate. That's been achieved by using an expander. And I'll go through that as I go through the case. Bite together. So what's left to do is just some settling of the occlusion. With good elastic wear, we'll probably be taking your braces off in the next 3 months or so. Okay, good. When she was 16, and I was chatting to Mum about how unfortunate it was that I didn't see her when she was younger, because obviously the palate, which is the floor of the nasal cavity, that midline suture, that changes with age. So between 7 and 9 is the ideal age to use a standard expander because the suture's open and the jaw's growing, and you really get some maximum growth of the jaw during that age. As you get older, it's not as though you can't expand, it's just that the expansion becomes more complicated. So you can use a device called an MSE, where we put tags in the palate so we can split the suture, or the worst cases, we need to do orthodontic surgery. But I make that decision by ordering a special x-ray called a CBCT, and the CBCT kind of allows me to look at the suture to advise the parent what needs to happen and what's best for their child. And the American Orthodontic Association, they recommend a child should be seen by an orthodontist as early as 7 for this sort of reason. Because the old adage in orthodontics, you bring your child to the orthodontist when they're a teenager, when they have all their adult teeth, so like 14. But by that age, the facial growth is complete, and it's very hard to change that. So in this young lady's case, the unfortunate thing was Mum did the right thing, and she took Aisha to a doctor to seek an opinion, and she was kind of told, well, too young, come back when she's older. Then maybe you could say what happened when eventually they wanted to start treatment. What did they suggest?
Yeah, it was braces, and me thinking braces, that's the only thing. I never heard about expander in my life. And when time came, we had appointment, starting treatment. Oh, it's too late, we need to do surgery.
Yeah.
It's a really crazy moment. We both cried and I was speechless.
Yeah.
You're just frozen, you don't know what to do.
Yeah, I imagine. And I think to this day, you'd seen a few people that were all suggesting the same sort of thing.
You're going for appointments, you're visiting specialists. So you're thinking those people have knowledge and skills and
Yeah.
they're educated enough. I have no idea about orthodontists. So you trust.
Correct. And I think it's confusing for parents because they get one opinion from Dr. X, another opinion from Dr. Y. I guess they want to do the best for their children. I'll just show you.
Yes.
So this is Aisha when I first saw her, and you can see that the upper jaw or the palate was super narrow. Now, it's not as though that happened overnight. That has happened over many years of her mouth breathing. So, who do we involve in the proper diagnosis? The medical doctor should have been aware that the girl was a mouth breather. Someone should have referred early to an ear, nose and throat doctor. If you look at the x-ray that I took, you can see already the face is elongated. You can see already the very large adenoids. Now, for a girl who at that age, I think you were 16, right? Yeah. To still have massive adenoids and mouth breathe is not good. So if adenoids were going to be dealt with, they should have been dealt with also early. I work with a number of very good ear, nose and throat doctors that share the same philosophy of early intervention. But the good news is, and what I showed you a minute ago, is that we were still able to expand the jaw, but we did it slowly. And the reason I did it slowly is because of her age. Her suture, don't get anyone telling you that sutures fuse. Sutures off their head never fully ossify, but they remodel. So the way you widen them changes. So in this young lady's case, fortunately, when we did her CBCT, we could see patency of the suture. So we went for a standard expander, not for MSC, not for surgical expansion, but we did it slowly. And have a look at the amazing results. So again, if I take you back to where we started, and then you have a look at where we are now, that's an amazing change, right? Do you want to just tell people what it felt like having the expander? Because I think when I do a consultation, I show kids this, you see their eyes light up and they think it's a medieval torture. Did you want to, what was your experience?
Well, obviously it's a bit uncomfortable at first. You have a new thing in your mouth and just the procedure is really overwhelming. But with a good orthodontist like we have here and the slow expansion, it got more comfortable as time went on. Mm-hmm. So the slow expansion helps you adapt to it. And yeah, it felt really comfortable after maybe a week or two actually.
And you noticed an improvement in breathing initially when that palate started widening?
Yeah, I think so, especially at the end of the process.
And this young lady has a lot of nasal allergies, and Mum and I have got to convince her to use a nasal spray. Yeah. I think that's what it comes down to, because otherwise the only other way would be to reduce the adenoids, which we're trying to avoid. Right? So take-home message here is that we did slow expansion, so we never had the massive gap. If you look at some of my other videos, I use a technique called MSC for the older individual. We're talking sort of 20 and onwards. And we get great results, but one thing they really hate is they end up with a big gap, almost 3 times the size of Madonna's gap, and they just don't like the appearance of that. But the effect is the same. The palate that's like this, floor off the nose, goes this way. In fact, with the MSC, what's great is the expansion is done using this technique, so it really improves the nasal airflow. But we didn't need to put the TADs in this age group, nor did we need to do orthodontic surgery. And that, I think, is really good for a child to avoid having to do jaw surgery and also to avoid having pulling teeth out. So when I graduated from orthodontic school, all we were taught to do when a kid had crowding was to pop out 2 teeth in the top and 2 teeth in the bottom. That gave you straight teeth, but it has a negative effect on the nasal airflow. What we do now, and what I've done in Aisha's case, is I've widened the palate. Can you see? And that makes the room for the canine. So have a look at this young lady, and you can see how hard it would have been for her for brushing, right? Also just appearance. I'm sure you weren't too keen on smiling with teeth like that now, right? And if you look now, look at the change. Now, we haven't finished the case, and there's not a lot left to do, but I really want to work on continuing with the improvement in the nasal breathing. So my philosophy here, widen the palate first, then get the tongue on the palate. Now, when the tongue's on the palate, it becomes a retainer. What prevents the tongue going on the palate sometimes is a tongue tie. She doesn't have a tongue tie. The other thing, of course, is nasal obstruction. She definitely has nasal obstruction. And Mum's working with a very competent ear, nose and throat doctor to reduce that related to dust mite allergies. But unfortunately, we're in Australia, and unless you want to live in a bubble, there's dust everywhere. So it's probably the hardest allergy to deal with. But the ear, nose and throat doctor that we're working with is going to start with nasal sprays, and then maybe work on to immunotherapy to try and improve that situation. But if we can get this young lady breathing through her nose, lips together, tongue on the palate, we're going to get very good stability with this case. So maybe be a good time to chat to Mum and just what were your expectations initially? I know we had many discussions and you were a little bit anxious and maybe a little bit non-believing that we could achieve this because everyone else had told you it wasn't possible.
Well, actually, I believed you at first.
Uh-huh.
I actually did. As a parent, you have instincts. You know, if you feel something's wrong, something is definitely wrong. And I remember first time visiting you, and you showed me this, and I believed it the same minute, because when I talk with you, I could recognize your knowledge and experience, and you know you can do that. I know my skills, and when I say I can do something, I can do it, definitely. The worst feeling for me is anger, but that anger is on myself. Not being educated, it's not our fault, parents, but I really could send a message to all specialists. Please talk with parents, we're not dumb and stupid. I could understand you explain Aisha's issue to me in 3 minutes, and I get it. And it's easy to explain. Don't look for excuses. Other specialists, please. You don't have time. You don't have enough to do. We will not understand. You will be stressed or whatever. We need an information. If there is a health issue, please tell us. And you did it, and I believed you immediately. I saw your video. I researched, and I came home. I saw how you explaining, and you using proper English language to explain. And it was really, that's it. And we watched videos at home, and I told Aisha. And when we left your office first visit, and I asked Aisha, are you happy? Yes, immediately. It was straight yes. And that's it. Would you like me to look anywhere else? And she said, no, I'm fine with it, that's it.
Yeah.
And she needed to accept you as well.
Yeah.
I recognized your skills, and I believed immediately.
Well, we're both happy with the results that turned out.
Yes.
And one thing that I like to say to parents, if you have a child who has dental crowding and someone's suggesting pulling teeth out, I think get a second opinion. Secondly, if you have a child and you notice when they're sleeping sort of like their mouth open, that's not good for growth of the face. This is a booklet that I'm happy to send to any parent or any interested individual, whatever health profession you're in, where we look at what happens when a child mouth breathes all the time and the face can get longer. Whereas what we want to try and achieve is these sorts of results. And we have an example of that. And this is probably you as a young girl, right? But you can see while the jaw's growing, you can direct what's called backward growth or long face to forward growth. So you get a stronger chin and a more balanced profile. And the stability of that is increased if you treat early. Because remember, when you move teeth, you can move teeth at any age. I treat a lot of adults, but that doesn't change the face. What we're talking about is orthopedics. So dentofacial orthopedics is the key. And the correct age for dentofacial orthopedics from all the authorities is while the face is still growing. And that's what parents have got to understand. So if your child has, like in this situation, a narrow jaw and mouth breathing, problem, then you don't wait for that to get worse until all the teeth come through. What you want to do is to get in before the adult teeth come through, change the size of the palate, change the breathing, and then for many of my patients, we minimise even needing braces. This young lady's obviously gone through the whole gauntlet of treatment and is still undergoing that. But I'm sure that if we could, play back the clock and I saw her at 7, we could do what's called phase 1, just a simple intervention. But at any rate, we're still going to get a good outcome for you. Anything else you want to say before we finish the interview?
Well, I just want to remind people that the process will be overwhelming and you will definitely experience some pain, but it will definitely be worth it in the end.
Perfect. And Mum?
Also, I agree with Isha. It can be scary at start, but have confidence. If you know what's happening and you know that results will actually be health benefit at first, breathing health benefit, appearances second stage, that's also, of course, it's very important, but breathing problems, allergies, obstructions, and so many things is connected there.
Absolutely.
And we are their parents to educate ourselves, to ask questions, to actually know what's happening.
Yeah. In fact, when you're talking about the health benefits, I think this is a good example. If you look at the nasal cavity and you look at the septum, you look at the floor of the nasal cavity, which is the yellow, it's the same bone as the palate. So as orthodontists, we're dealing with this side of the palate. The ear, nose and throat doctor is dealing with that side of the palate. The combination of the two is what's really giving the outstanding results. But it's the timing of the treatment. So we also, if I can find it, have another brochure which I put together with my ear, nose and throat doctor, which helps parents understand how nasal airway can affect facial bone development. And if you have things like adenoids, which this young lady had, or huge tonsils, or allergic rhinitis, or deviated nasal septum, or large inferior turbinates, all these things. And unfortunately in Australia, the majority of the population are immigrants, and we're in a land which has very unique flora and fauna. So every second kid I see has allergies, right? And those kids who don't have allergies, because we're a big sporting nation, end up hitting their nose. So that's why ear, nose and throat doctors are so busy. But I think timing that breathing issue with the expansion of the jaw is the important take-home message.
And also, I don't want to miss the actual situation, the birth situation, which is in child turning 16.
Yeah.
The most common recommendation is surgery, which was offered to us as well. And that's scary stage. And you agreed to go with this, and you check all measurement, you check x-rays and everything. You agreed and we accepted. Don't wait. So if surgery is the only way, I actually don't think I would go with surgery at all, even if it was that scary surgery.
Okay, that's a wrap. Good, thank you.